Respiratory assessment is an examination that can offer significant clues related to the body's ability to obtain adequate oxygen to perform daily functions, because inadequacy in respiratory function can have significant implications in a person's overall health. So a focused respiratory assessment includes inspection, palpation, percussion, and auscultation. It includes interpretation of vital signs, inspection of the patient's breathing pattern, skin color, and respiratory status, palpation to identify abnormalities, and auscultation of lung sounds using a stethoscope. Gather the supplies needed for the assessment, such as the stethoscope and the pulse oximeter. Perform safety steps. First, perform hand hygiene and other infection control procedures to prevent the transmission of infection. Then, check the room for transmission-based precautions and don appropriate PPE. Then, introduce self to the patient, your purpose, role, and tell him or her how many minutes will the examination will take. Then confirm patient's identity using two identifiers, full name and date of birth. Then explain the procedure, and after that, ask if he or she has any questions left. So, good morning, Miss Agatha. I am Hannah, your nurse for today. So for verification purposes, could you please state your full name and date of birth?
I'm Agatha Shin, born on November 15, 2007.
Okay. So today, I will perform a respiratory assessment to assess your respiratory function. And it is a painless procedure which could take from 5 to 10 minutes of your time. Then, it requires you to expose your chest area in this procedure. So is that okay with you?
Yes.
Okay. So be organized and systematic in doing the assessment. Then use appropriate listening and questioning skills. And listen and attend to patient cues. And of course, ensure patient's privacy and maintain his or her dignity by closing the door to the room and closing the windows. Also, assess the patient's ABCs or airway, breathing, and circulation to know or to assess if the patient can tolerate the procedure. After performing safety steps, I will obtain subjective data through an interview and gather information related to the history of respiratory diseases, current symptoms, medications, and history smoking of the patient. So, Ma'am Agatha, I will ask some questions to you. Is that okay with you?
Yes.
So, okay, here it goes. So, have you been diagnosed with respiratory diseases such as pneumonia, COPD, or asthma?
No.
So, do you take any medications or supplements to ease your breathing?
No.
So, do you have an oxygen equipment at your home?
No.
So, do you have difficulty in breathing?
No.
So, do you find it difficult to breathe when you are lying down?
No.
Okay. So, do you have a cough?
No.
Okay. So, do you smoke or vape?
No.
Okay. So, after obtaining subjective data through an interview, I will obtain and analyze vital signs, including pulse oximeter readings. And act appropriately on unexpected findings outside of normal range. I will assist the patient to a seated position if tolerated. Then, provide privacy by exposing only the areas needed for the assessment. First, I will assess the patient's level of consciousness to look for signs of hypoxia or hypercapnia. So early signs of hypoxia include anxiety, confusion, restlessness, change in mental status, and level of consciousness. So ma'am, I will ask you again a few questions. So what is your name? Can you remember it?
Agatha Shin.
Okay. So do you know where you are right now? you right now?
In the hospital.
Then do you know what day is it?
December 7, 2023.
Okay. So the patient's level of consciousness is intact, and she is oriented 3 times to time, person, and place. Then I will count the respiratory rate for 1 full minute. So the patient's respiratory rate is 18 and is within the normal range. Then I will also check the respirations for rhythm pattern, depth, symmetry, and work of breathing. So the patient's breathing is unlabored and has a regular rhythm and shows no signs of difficulty in breathing, such as nasal flaring and use of accessory muscles. Then I will also observe the configuration and symmetry of the chest. Then compare the anterior-posterior diameter to the transverse diameter. So normally it is 2:1. But in COPD patients, it is 1:1, or also we call that as parallel chest. So for Miss Agatha, her anterior-posterior diameter is 2:1, so it is normal. So her trachea is also in midline and the clavicles are symmetrical. Then I will also inspect for the skin color of the lips, face, hands, and feet. So there is no signs of cyanosis and pallor in the said areas. And the patient's complexion is tan, hence it is normal. So I will also inspect for clubbing of fingertips, if the patient has a history of chronic respiratory disease. But in Miss Agatha, clubbing is not visible, and it is normal. Moving on to palpation, I will first compare the chest for bilateral chest expansion. So I will place my hands anteriorly and the thumb over the sternum while the patient performs deep breathing. So ma'am, can you please inhale deeply? Then exhale. So bilateral chest expansion can be assessed if the thumbs moves apart symmetrically while the patient inhales, following the movements of the chest. Compare for bilateral chest expansion posteriorly by placing the hands on the back and the thumbs over the spine. Then let the patient perform deep breathing. Ma'am, can you please inhale? Then exhale. Inhale, then exhale. So there is a bilateral chest expansion because the thumb moves apart symmetrically when the patient inhales, following the movements of the chest. Then, inspect the anterior and posterior chest walls for areas of tenderness, crepitus, lumps, and masses. There is no any areas of tenderness, crepitus, lumps, and masses, hence it is normal. Auscultate lung sounds using the diaphragm of the stethoscope directly over the skin of the designated auscultation areas. To listen for lung sounds and any abnormal or adventitious lung sounds. So it is important to listen for the full cycle of respiration, both the inhalation and exhalation, to fully determine if there is a normal or an adventitious lung sounds. Then also tell the patient to deep breathe through the mouth so that the lungs will expand and you can listen for lung sounds very well. Mom, could you deep breathe through your mouth as I place the stethoscope on your chest? Okay. Inhale.
Avoid listening over bones, such as scapula posteriorly and clavicles and femoral crest anteriorly, to ensure you are hearing adequate sound transmission from the lungs. So this side-to-side pattern of auscultation allows for comparison of sounds in symmetrical lung fields.
The respiratory assessment is now done. Then I will now assist the patient to be in a comfortable position. Are you now okay in your position, ma'am? Are you now comfortable?
Yes.
Okay. So thank you for participating well in the assessment. So before leaving the patient's room, perform safety measures. Put the call bell and table within the patient's reach. And place the bed in the lowest position and locked. And secure the side rails. And also ensure that the room is risk-free from falls. Scan the room and clear any obstacles that can hinder the safety of the patient, then provide adequate lighting to the room. Perform hand hygiene and other infection control procedures to prevent the transmission of microorganisms. Then, document assessment findings and report any concerns according to agency policy.